provider. I'll be moderating. I work with TC Fit. TC Fit has an agreement with Motion, so I also work as a physical therapist at Motion Physical Therapy. And we're here today to discuss kind of getting back at it from a running or walking perspective. So we have physical therapists online and a running shoe expert here, or a walking shoe expert as well. We want to forget those walkers. And we have special guests. I'm gonna briefly introduce them, but I'll let them introduce themselves too. So on this call, we have Chelsea Kipp from Mill City Running, and it sounds like Mill City just opened a sister store in St. Paul. Mill City is in the Northeast Minneapolis, and they just opened St. City Running, which is in St. Paul in Highland Park, correct, Chelsea?
Yep. The rumors are true, yeah.
Okay, great. And then you store manage, and where do you manage a store? And then tell us a little bit about your running background.
Yeah, so I work with a team of managers across both stores, so you can find me at both locations, kind of depending on the day. I've been working in run specialty for coming up on 8 years now. I've dabbled on the event side with Twin Cities in Motion as well. So just been a recreational runner through my adult life, and have really found a passion working in run specialty and sharing that sport with others at kind of every level.
Great. And so we've at General Mills have worked closely with Jeff and Becca Metzdorf, who own Mill City and St. City Running, to provide some on-site services. And of course, now we're all virtual, and we're figuring that out as we go as well. So anyhow, we also have special guest and running mechanics expert, Michelle Steggy, doctor of physical therapy at Motion Physical Therapy down in Minnetonka. Michelle, can you just give us a little bit of background about your credentials and who you are, and tell us about what types of running injuries physical therapy can help?
Yeah, absolutely. So my name is Michelle. I'm a physical therapist. I've been treating for over 6 years. I am a board certified orthopedic specialist. So orthopedics covering pretty much anything, any type of injury that you might have with running. And then the typical injuries, aches and pains that you might see a physical therapist for in an outpatient clinic. So low back pain, neck pain, post-operative care, ACL reconstructions, all sorts of stuff like that. So I am a runner myself. I just recreationally enjoy running. So I really enjoy working with people to help figure out how we can keep them running through an injury, and improve performance as well. I have a passion for strength training and teaching people about strength training, especially runners. It's something that can make a huge difference in your performance and preventing injury or coming back from injury. So that is one thing that anyone who sees me is going to get some of. So a little bit about me.
Great. We also have in the background TC Fit physical therapist Andrea Myers. And Andrea, you don't have to put your camera on if you don't want to, but Andrea, I think, adds a different texture because she's a multi-sport athlete, has a long history of high-level multi-sport athleticism. I don't know if we still consider her a high-level multi-sport athlete, but she's saying no. But anyhow, for those of you who are triathletes, Andrea might be able to answer some questions surrounding that as well. So with that, Michelle Hodap is going to get upset with me because I neglected to say that this session will be recorded and posted up on our YouTube page. So you are being recorded, everybody. I hope everybody's okay with that. So if there's no questions, remember these fitness forums are open, like a panel discussion. So those of you who have questions, we'd love to see your face. Turn on your camera and ask questions. I have some questions in the can for our experts. For those of you who don't have questions and just want to be shy, but this is for you, so ask questions, and we'll be here till 12:30. We'll try to make a hard stop at 12:30. We'll provide contact information for all the specialists on our panel if you want to reach out later. So in short, I have one quick question for both Chelsea and Michelle, and Andrea, you can pipe in as well, but has this barefoot running craze, is it finally behind us? Is that trend done? Because this was a big deal probably 5-6 years ago after Chris McDougall's book, that everybody, if you were running in shoes, boy, you're going to cause problems. Anybody want to take that one?
I can start. I personally in the clinic have very rarely seen people coming in that are barefoot runners at this point.
Okay. I mean, I know that there was a big Vibram push. This is, again, 5-6 years ago. And then people running in Newtons, which is a different type of shoe that promotes more of a forefoot or midfoot striking pattern. Chelsea, what are your thoughts on this barefoot Vibram and Newton craze that was? Is this trend behind us? Is it no longer trendy? Because I know where we're moving, but I just want to know what your thoughts are.
Okay.
Can you hear me, Chelsea? I don't know if Chelsea.
I'm not sure if the question was for me. Let's see. Okay. Is the question about minimalist shoes?
Yeah, I just want to know if that trend is behind us or not. Is that something we should consider?
I think for the most part, it has kind of come and gone. There's maybe a couple relics of it. The brand Ultra comes to mind. They offer like a shoe with a 0 drop, meaning that internally your heel and toes are sitting level with each other, which kind of gets at that minimalist concept. But in favor of it, we've seen a big rise in the brand Hoka, which has a more maximal approach to cushioning. So you can see there's a lot of foam. This is a shoe that's growing in popularity immensely. And I think more and more just the thought of having more cushioning seems to appeal to a wider audience of runners lately.
Yeah, and just from my own personal experience, I run in Hoka's, Chelsea, so I'm a convert, and I know Andrea has Scott a convert. Your husband, Andrea, is he a convert yet or not? But I tell most of my runners who are over 35 and dealing with any kind of like degenerative change in hips or ankles that tell them just to try them, just to consider them, because I do think that any ballistic pressure we can take off those joints is good. Any comments on those Hokas? Because I'm a big advocate for Hokas for not everybody, but for the certain type of patient that rolls through.
I think I see the opposite, where people are still trying to follow that minimalist trend and just aren't prepared for it and just going too far the other direction. So I think Hokas are just a lot more friendly to people in general. I don't like them personally, but that's just everybody's a little bit different, right? So I recommend that as well from that standpoint. I have a harder time recommending people go with a 0 drop just because it's so hard for bodies to get used to that difference, unless they really kind of ease into it now.
Andrea, you're a little muffled. I'm not sure what's going on. Is everybody else getting that pickup? But I don't know if there's anything we can do about it. You weren't like that before, but anyhow, I'm not sure what's going on. But hey, a question for Michelle and or Andrea. But I guess as some of us are coming out of our COVID-15, whatever you want to say, people are starting to warm up outside, though today isn't an indicative of that. Looks like the sun's trying to peek out. But what advice do you have for people that want to get back on the road and want to start maybe more of a get outside and more of a cardiovascular, start a return to run program or return to walk program? Are there any things that they should consider as we move forward?
Yeah, so one of the things I always recommend, first of all, it depends on what you've been doing. So if you're starting from absolutely 0, I always recommend starting with short intervals of running and walking and gradually building there to a steady state run. So that may start with 1 minute of running and then 3 to 4 minutes of walking, and you do that interval over and over for could be somewhere between 15 and 30 minutes, again, depending on your background. And that's a great way to start. It allows your body time to adapt to those forces without overdoing it right away. So that I really like. And then for someone who's past that point where they're more of, they've been doing some running over the winter, but it's just a transition, maybe they're increasing volume because of a race coming up. I recommend sticking to somewhere between 10 and 30%, never more than 30% increase in volume per week. And so there's some research out there that supports the 10 to 20% increase per week to reduce the risk of injury with that increasing volume.
Right. And Andrea, do you have anything to add to that at all?
No, but I can tell you every running injury I see is the too much too soon injury.
Yep.
It's
Yeah,
really hard
too
to-
much, too soon. Yeah. Right. Good point. I do think that that's something else, Michelle, and hopefully you agree with me, that something that maybe should even be considered just every other day. I tell a lot of my patients that with a return to sport, return to run program, or return to walk program, whatever you're doing, I tell them, hey, you might not have pain while you're doing it. You may not have pain right afterward. How do you wake up the next morning? It's important to consider that as well, how you feel the next day, and give yourself a break. And it should be fluid and really, especially I turned 50 this past July, and I've learned to listen to my body, and because aches and pains do occur, but you want to do the right thing. There will be discomfort, but knowing when. And then maybe that's another question I can ask Andrea and Michelle. When do I seek the services of a injury prevention specialist, your doctor, physical therapist? When's the right time? When do I need to? When can I self-treat?
Yeah, I always tell people you could never come in too early, because even if it's just to get advice and get ahead of something, I would never say it's too early to come in, because education is a huge piece of what we do, and that could come for someone who's not even injured. That being said, if someone was just trying the wait and see approach, I would say typically a week or two, no more than that. If it's lingering past that time and you've taken the time to reduce the volume, give yourself a little bit more rest, decrease the intensity. If it's still lingering, then it's definitely time to see somebody. And on that note, in Minnesota, most private insurance allows you to see a physical therapist without a referral. So we can be those first people that you go to. And then if it's something that's outside of our scope, then we refer you on.
That's great. Okay, agreed 100%. Chelsea, can you tell us, are shoes for walkers and runners different at all? And then I guess outside of the Hoka, which I love, is near and dear to my heart, what types of shoes are hot right now? You're muted, Chelsea.
Thank you. Okay. So I know the second part of your question was which shoes are kind of hot right now. Can you remind me the first part of the question?
I asked, are there different shoes for running and walking? If I come
Sure.
into one of your stores and I'm a walker, am I going to be not in the right store?
No, you'll absolutely be in the right store. We have even a neon sign in our Minneapolis location that says not a runner. So we specialize in runners and not a runners alike. Typically, like the structural elements of a walking and running shoe are really similar. Most everything you'll find in our stores might technically be classified as a running shoe, but are really well suited to walking. Where they kind of differ is that running shoes are going to place a greater emphasis on breathability and being lightweight, where a walking shoe that maybe we've thought of in the past is something like a leather, more heavy weight shoe. Structurally, they're going to do the same things for you. So I think if you're outside, especially this summer as things are getting hot, having that breathability and really lightweight elements is only to your benefit. We specialize here in a fit process. So if you're new to the sport, or just maybe it's time to reevaluate the shoes you've been in for a long time, we can take you through kind of a multi-tiered assessment to work with you to figure out what's going to be the most appropriate shoe for you. So like I mentioned before, Hokas are moving really quickly in our stores. I think it's something that's catching the eye of a lot of new walkers and runners. But there's all sorts of really, really awesome things happening. New Balance has had some really awesome options in the last year. Brooks is a consistent tried and true brand for us, but we carry close to a dozen brands of shoes. So when you come see us, there's no shortage of options for you to check out.
That's great. Do you, when you come in, do you guys analyze gait? Do you have a treadmill there? I typically, when I go refer my patients to your local independently owned running stores, I usually tell them to go at the end of the day, because I know your foot swells a little bit, and to wear the socks that you're going to run in just to try to get a good fit. Are there any recommendations with that fit process from a consumer standpoint, not from your expert standpoint?
Yeah, I think to piggyback off of your point, as kind of a COVID protocol right now, we're giving you guys socks to try on in the store anyway. So if you forget your socks at home, don't worry, we've got you covered. But yeah, bringing in your old running shoes can be helpful just for us to get that kind of historical knowledge of how those are wearing and how they're working for you. And then the fit process itself consists of, we watch a barefoot walk to get a kind of early assessment of what's happening with the pronation, maybe in your ankles. We have a foot scanner, so that consists of 18 cameras and a disc that are going to give us a really nice, precise measurement of your foot, and maybe point out some anomalies that maybe you know about your foot, but might be news to me, like, do you have a really wide foot, or is there a little bit of variance in length of your feet? From there, we'll put you in a shoe that isn't going to change your gait and allow you to run on the treadmill for a short time, where we take some video and can really put all those pieces together to make some informed recommendations of where to start. And then kind of the final piece is really just comfort and preference. So, we'll put the right options in front of you, but then you get to be in the driver's seat and pick out which ones are going to work best for you.
Right. I always recommend that try not to look at, everybody's got a budget, but try not to look at the price or the color. If there's a choice, find that color afterwards. But I do think getting in the right shoe is important. Oftentimes, I think the biggest mistake I see is people that stay in a shoe too long before getting a new shoe. How many miles or how many hours can I put in a shoe before I should consider, following up with a new pair?
Yeah, typically the most appropriate way for us to measure it would be mileage. So if you have a way of tracking it, 300 to 500 is kind of that sweet spot to come in and get that replacement. If you don't track them or you're not quite sure, your body often will tell you, but I'd say probably no more than a year, if closer to 6 months to a year. If you're running or walking with any consistency, those miles can add up really quickly.
Okay. Great, thank you. We have a question on the chat box. I think this is more for the PTs, but Chelsea, if you have some ideas as well, be welcome to your input as well. But Andrea asks, what can I do for plantar fasciitis? And that's a tough diagnosis oftentimes, as we know. I have heel cups. Anything else? Andrea or Michelle, or both?
For plantar fasciitis, I think a lot of it depends on how chronic it is or how new it is. And so heel cups, I think, are great. Outside of that, the first things that I always recommend that are just easy things that you can do at home, and this is typically the stuff that if you Google plantar fasciitis, these are the things that you would typically see. But I do think that doing some calf and foot stretching is super helpful. And then to just work those tissues on the bottom of your foot using either a lacrosse ball or a golf ball, especially if you've been sitting for a long time or right away in the morning, if that's when it's really painful, using that and just kind of rolling that ball across the bottom of your foot can be helpful to loosen up those tissues before you get onto your feet. And that could be something that you could do as well before running or walking.
Mm-hmm. What are your thoughts on night splints?
I know for some people they do work. There's some decent research to support them. It's not always the first thing I recommend, but if somebody's really struggling and not seeing success with other things, that would be something that I would consider.
Yeah, typically I have traditionally used that Strasbourg sock where it puts a little bit of extension in the great toe to provide a little bit more stretch to that plantar fascia. A lot of people can't tolerate them. I had plantar fasciitis myself. It's not fun. And the Strasbourg sock, I could make it till about 2 in the morning because I move around a lot. I would have to rip that thing off. And my wife would startle her because the Velcro would, and that's about. And I tell people, don't be me. Wear that thing because I do think that they can help. So there's a lot of varieties out there. Any mobilization, I agree that you can get, and that soft tissue is going to be helpful. Andrea, anything else for plantar fasciitis?
I also don't usually jump right into the night splint just because people can't sleep with them on, so it's not super effective if you can't use it. But the other thing I usually suggest is no walking barefoot in the house, that you've got not just slippers, but decent supportive shoes that you can throw on right away in the morning and avoid that barefoot walking.
Agreed, especially if you have hardwood floors, because those first few steps, it seems like somebody's putting a paring knife right in your heel. I think that I do tell people to stretch that plantar fascia before they even get out of bed and just do some quick cross friction massage. Happy to share some tips in our chat box at the end, or our YouTube, that description. But also, I recommend, and you guys can refute this if you'd like, but I don't like to wear shoes, and sometimes I just recommend those Adidas slides, the old school ones that have a little bit of a footbed in it, so you can just slide your feet in even with your socks. And I find that those are helpful to cushion that plantar fascia, and it's not like you're wearing shoes all the time, but it does help, and they have just enough little support and cushion in there to help. So, Chelsea, do you guys have any slide type sandal stuff that you recommend for people who have plantar fasciitis?
Yeah, I guess typically the lens isn't necessarily as a treatment for plantar fasciitis, but if having some cushioning and support under your foot is the goal, we do carry like Hoka, a brand we've talked about a lot. They make a slide model, so we carry those in store as like a recovery sandal. They're going to be a pretty nice soft foam, but they do have a little bit of that arch contour to them as well.
Right.
I think in addition to everything that was said, certainly like making sure you're in the right shoe that's supporting you foundationally correctly is certainly important, but with plantar fasciitis, there's not necessarily a one-size-fits-all answer to that as far as footwear goes.
Yeah, and just from a PT perspective, we look up the chain too and look actually into your core and your glutes and see how those things are firing as a way to try to mitigate this sometimes very difficult diagnosis. It's not only frustrating for the runner or walker, it can be very frustrating for clinicians because there's not one perfect treatment for everybody all the time. So, all right. We're moving along here. I'm trying to keep an eye on our time here. We're doing great. Any other questions from the audience, please let us know. Can we talk a little bit about trail shoes versus, out on trails versus on pavement around the lakes versus getting out on like the Highland Park or something? And sorry guys, we've got some roof work here. Michelle and I are in the same clinic, and if you can't hear me, I might mute out and come back in because there's some work being done on our roof. I apologize. So any difference in those shoes, Chelsea?
Yeah, so we do carry a variety of trail shoes. The main differences typically are going to be just a much more pronounced lugs configuration on the outsole of the shoe. So you're going to have a lot more traction to work with. Oftentimes, as an added bonus, there'll be a little bit of like water resistant elements to them. Kind of the pros and cons. If you're not doing a high proportion of trail running, I think sticking with a typical road shoe is probably most appropriate. But if you are doing some of those more technical things, getting out to Afton or the Superior Hiking Trail consistently, then having that added traction is going to be really beneficial. The other kind of nuance point to that too is that oftentimes they don't make them with a stability component that's going to correct if someone overpronates to some degree. So we can certainly work together with you to determine maybe you need a stability shoe for that road shoe and decide whether that's something we need to look into more closely for your trail shoe, whether it be an insert or something like that. So another question we sometimes get will be like, can I wear these trail shoes on the road? The short answer is yes. Like there's likely not harm to come to you from that. The downside would be just that the cement and pavement wear on those lugs is just going to wear the shoe down a little bit quicker than it might on softer surfaces.
Gotcha. Right. One other thing I think that, for those of you who, I know we're coming in spring and we're emphasizing that, but I do recommend yak tracks for people who are running in the wintertime. I've seen some horrible injuries from people slipping on ice in the winter. So getting good traction in the winter is important as long as you're talking about those lugs. Hey, Chelsea, I have a bunch of old running shoes that sit around, and outside of using them to cut the grass and work in the yard, what happens when I do need to get rid of those? I hate to throw them in the garbage and contribute to landfills. Is there another option?
Yeah. So at either of our store locations, you can bring used running shoes. Maybe our only ask would be that you lace them together to match that pair. But really, in just about any condition, we'll take a running shoe. From there, we kind of decide which kind of direction they'll go to as far as do they get donated to a charity organization that can reuse the shoes, or do they get repurposed and recycled for the materials themselves? So we're happy to take them off your hands and they'll go to a good home.
Good. And then they don't go into the landfill, most of them, hopefully. Great. And then I do have one more question for Andrea and or Michelle. I guess Chelsea had talked about kind of what they look at with their gait analysis. I know that in physical therapy, a lot of times we put cameras on people and do gait analysis as well. Can you tell us common running faults and kind of what you look to and what people might get from a running analysis? And do you need an injury to come in to benefit from that?
Definitely don't need an injury to have a running analysis done in our clinic. And when we are doing that, so we're looking basically from top to bottom, what's happening from even in your upper body. What are your arms doing? How are they swinging? What's happening at your trunk, hips, all the way down to the feet. And so taking a couple different angles to just see what everything looks like. And then a lot of times too, we may do some assessments of range of motion, flexibility. If there's an injury, we're going to look a lot closer at that area as well. But some of the common things that we see with running is a lack of stability while you're on one foot. And so a lot of times what that looks like is when you're landing on one foot, your opposite hip will actually drop a little bit. And sometimes that knee of the leg that you're standing on is coming in more. And that's just telling us that there's a lack of stability when you're planting on that one leg. And a lot of times that can come from either the foot or the hip or a mixture of both. That's probably one of the things that we see most commonly. Andrea, anything else that you see a lot? Okay. I'm always looking at too, we look at cadence a lot. Cadence is one of those things that I will frequently change if someone is having pain.
Michelle, can you, I'm sorry to interrupt, but can you define what cadence is?
Yes. Yep. Thank you. So cadence is how many steps, how many times your foot is hitting the ground in 1 minute. And so it's basically that beat that's happening every time your foot hits the ground. And so a lot of times if someone is having pain, that can be a thing that we can change and keep them running with less pain. So if we increase your cadence a little bit, it can decrease the force that's going through the leg every time you hit the ground and can sometimes reduce that pain that you might be having with running. So that's something that I'm always looking at as well.
That's great. Well, we are getting very close to the end here. I know Michelle has a special announcement of General Mills program that can be used to get out and get active. Michelle, do you want to comment on what's coming on in the next few weeks here?
Yes, I just want to share two things with the audience. The My Wellbeing Virgin Pulse Pro.
Michelle, you just muted yourself. I'm sorry.
There we go. The My Wellbeing Virgin Pulse program has an upcoming event. It's a National Park Step Challenge. So you can register starting today, and the actual step count challenge starts on May 3rd. You can do that as an individual or a team up to 4 people. So check that out. And also, we're going to continue this conversation in 2 weeks with the next fitness forum, which is walking. So we're all going to get out and take a stroll. So check that out on the Champions events page to add the May 5th event to your calendar, 11 a.m.
Great. Thank you. Well, I appreciate Michelle, Chelsea, and Andrea for being our panel experts today. We'll try to put their contact information in the description on the recording that will go up on our YouTube page. And thank you, everybody, for your kind attention. If there's any questions that people have, please don't hesitate to reach out as you digest this conversation today. And thank you for attending another Fitness Forum.